Fans of Cameron Boyce are devastated to learn of his passing. The Disney Channel star basically grew up on the big and small screens. A spokesperson for the Boyce family said Cameron died in his sleep after having a seizure. His cause of death was due to an ongoing medical condition which hasn't been specified. Cameron Boyce was 20 years old. This is InsideEdition.com.
All right, guys, so here's a simple video of a patient that I found on YouTube documenting basically the activities of seizures. And I know we've all seen them on ER or these medical shows on really what a seizure is, but it's a lot of overhype. But you can die from these, and here's an explanation. Basically, a patient's basically writing. He also has some right arm movement. Then he has some tetany, some paralysis to the lower legs with some spasticity. As you can see it now, it started as the right arm, then moving to the bottom legs, then it impacted the left leg. Usually when someone's violently shaking like this is called a grand mal seizure, and usually in grand mal seizures or total body seizures, you lose consciousness. So if we were to interview this patient afterwards, he probably would have no recollection of it. And usually you have what is called a post-ictal phase, where the patient becomes very lethargic and fatigued. Thinking of this as, say, a computer just reset it. Your brain has to take time for it to get back to normal. So if someone's not intervening, like these nurses, which are one's using a yanker to suction out sputum, and another one is holding his head still, you can cause injury. The one thing you don't want to do is restrain the patient, because and a couple of times I've seen patients dislocate their arms, also even dislocate at the hip joint because of the tremors being so bad. So the big thing that you want to do is correctively stop the seizure. I usually give Keppra, we do loading doses, and then eventually try to transition to their oral medications. Most of the meds in this case will be given IV. Here the big thing in this image is really look at the patient, get them from the upward position and tilt them to the right side or to the left side. Essentially what you're doing is you're protecting their airway. If they're pulling saliva, they can cough it out and essentially not develop a pneumonia, or what we call aspiration pneumonia. This is also a possible reason or a way that maybe Cameron passed away. He later developed an aspiration, couldn't breathe, and then developed cardiac arrest post-seizure. So just to speculate a little bit, I don't know what the scenario was when Cameron had a seizure. Was he witnessed? Was he by himself? If he was by himself, it makes sense that he wasn't protecting his airway, and then he later was found dead. But here's some mechanisms. It's from a study from New England Journal. They kind of summarized a bunch of research. But in short, the big things that doctors are caring about is, are you, one, developing some cardiac activity leading to some electrical discharges causing a heart attack? We call these arrhythmias, or the one that we do care about is called VTAC or VFib. The one other thing is, if you don't suppress your initial seizure and you start continuing to have multiple seizures or untreated seizures, you start having a condition called status epilepticus. This is where the brain is now becoming permanently harmed from rapid discharging of electrical activity, and you can have essentially brain death. The other one is, if you're having brain activity dysfunction, you're going to have respiratory activity dysfunction, and then you're going to stop breathing. So that can also be another source. But those are usually the biggest ones that I have to deal with, which is breathing difficulty, cardiac arrhythmias. And then the other thing is, you can have a seizure very severe that it can induce a stroke. So you can have hemorrhage or bleeding in the body. Now, I don't know if Cameron is going to, or their family is going to have an autopsy to further investigate on why this happened or what occurred, as it's possible that he could have had intracranial bleeding. But to be determined, I guess, if the family wants to pursue this. It appears that he already had these conditions known, and maybe the family is not surprised by this possible outcome. All right, so another caveat is we don't know what underlying disorder he's had and when the diagnosis was made when he started having seizures. But also doctors use the age of when someone has a seizure to obtain clues. So for example, if you had a seizure maybe under 2 years old, it could lead you to these type of conditions. I'm not going to go into it, but also if you had seizures in your childhood, it also supports certain other types of seizures. And again, you can narrow it based on if you're having seizures as an adolescent and adult, or if there's a familial or some kind of genetic issue that's going on through your multiple family members. So I just did a quick search just to make sure my video was up to date for you guys. Apparently there's still no word regarding Cameron's death, and it appears certain media outlets are saying there's a delay in the autopsy findings because now they're suspecting possible drugs, or at least ruling out the cause of drug overdose. So usually when I test someone for drugs with their bloodstream, the results are back within hours. However, when the body is dead, the drug panels do take time and sometimes can take almost about a month of processing. So we'll still be in the wait on the pathology's results for the time being. Just stumbled upon this as well. Looks like family's obviously having trouble coping, and the fans are at least helping the family transition. Myself being a father of two, I can totally relate having a child being at least endangered or in trouble medically, and obviously I can't put myself in Cameron's dad's position, and I thank God and hopefully will never have to, but my heart goes out to the family, especially Cameron. I do recognize him from a bunch of Disney shows that my children do watch, and with deepest not apologies, but sincerity and empathy, feel for the family going through this process. So my concluding marks, just to kind of recap, if a patient is having a seizure, you want to try to lay them down, rotate their head. You don't want to put them in restraints because you can cause a fracture or dislocation. You want to try to get them in a safe area. You want to protect their head. And the big thing is really stopping the seizure so that they don't have permanent brain damage. Again, we use medications like Ativan, phenytoin, Keppra, which can help stop these. We also need to be worried about respiratory failure, basically stopping breathing, or cardiac issues like electrolyte issues or arrhythmias, which can stun the heart and put the heart in a heart attack. Or the other worst outcome of a violent seizure is potential bleeding in the brain or intracranial bleeding. The other big thing is when people get admitted for seizures, we like to watch them for underlying seizure activity, which is with a ECT. It's a type of brainwave activity monitoring system. I don't know if you've seen it, but a bunch of electrodes that go to the brain. And we're also assessing if the medications we just gave them has broken the seizure so they don't develop a condition called status epilepticus. If you guys enjoy this content, it's medically interesting, and I'm also tying it in with a bunch of kind of popular findings with celebrities because it's a little bit entertaining for myself. Give my site a smash, thumbs up, subscribe. If you have further questions, give me a comment, and I'll be sure to hit you up and respond. Also, if you guys have a question to ask the doc, let me know, and I can try to address those issues. And if you have a question, I'm sure the world probably has questions regarding that. And if I can make it easier for you to understand in simple terms, then great. Once again, thanks for the video, the love, the shout out, and have a great day.